So when I'm working with the hyoid, I don't necessarily have to touch it or for the jaw. So we made a quick reference to chewing, right? So even with, we think of the mouth and it comes through here, right? Now this comes down to a Feldenkrais technique, but you should be able to hold your jaw and close to the jaw. And that's actually usually very hard for people, versus, because you're used to the jaw coming to the mouth. So, but the chew, if you look, and this is where I post stuff like bunnies eating, the chewing really is a very rotational movement. You know, we can chew right side, left side, but you don't realize how much we organize that rotation until we lose a tooth or we have a cavity or something like that where we have to, or a canker sore, where we have to organize our mouths around that area. So when I'm working with, and I want that good counter, I might bring my thumb underneath kind of thing, and I'm just looking for how I'm going to move. Now, unfortunately, Fred doesn't have a tongue, but I would actually come in, rotate a little bit into the tongue area. Because I'm looking to see too where the hinge of the jaw, it wants to come back into play. So if I push over here and let's say I have a low tone child, yes, the tendency is just to go over versus over and come back. So just like I'm teaching you how to go here and come down, how the system wants to come back to you, it is really important in the jaw area. You know, none of us have to, you know, we get to a stage in our life very quickly. Our parents aren't going around saying, close your mouth or pick your, you know, they might when you're chewing or something like that. But so you're coming into the tongue area. So if I'm working with a low tone child, I might have that. Now, where it comes off to the side and doesn't want to come back. But also, and we're going to cover this more in the vision workshop, guess what? Any kind of strain or use of ocular muscles that you've seen at birth, and this is where, again, let's say we're picking on the baby from yesterday, Alize, that level of crying, there's a crying of, but she was, you know, this was a, you know, like a, and I'm just miserable. Like you couldn't hold her in a position to get her comfortable. And that's why I was thinking it was more drug-based than college-based. But, you know, it's going to get looked at as the same. But you squint like that and try and eat a nice fillet. You know what I mean? So if you have a strabismus, if you have exotropia, if you have any kind of ocular muscles that are either active, inactive, or uncoordinated, I'm telling you right now it's going to affect your chewing and your balance of the hyoid. Because of just, you aren't meant to use ocular muscles in that way. That's why babies don't have, let's say, depth perception right away, or convergence. They're meant to have a delayed visual maturation for a reason, because all of these other structures within the face, breathing and eating, swallowing, have to take place prior to finding balance before I have sharp vision. Does that make sense?
It takes so much of the brain power, the visual, that then everything else gets dropped so that you can just see.
Well, it takes over the brain power, but also it throws your countering off. So if I'm trying to tighten like this, right? This is very hard to do, like a, let's say a la 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 la, you know, or I'm gonna have fine motor skills of the tongue, right? So that's why a baby's like, you know, but they're getting all of that into play. So now power, sort of like a pubic bone strike, the hyoid bone needs to be able to come forward. And that's, again, what we see as pronating. Right? But if you have a good power, right, I can yell at you. It's very hard to yell when you're back here versus here. Yeah, we'll bring in the other Alizé for that. But she's not yelling, she's happy with her voice. She's got a good, so, and when you're working with those kind of things, you wanna come in behind. Now, when I mean behind, so, you know how the other day we did the shoulder with the bands, right? And I'm trying to show you this with the shoulder. Well, guess what, it gets pretty fine here. Now, I don't expect you to put a band around someone's, like, vocal cords, but you really want to think about touching, and that's what I'm gonna go into. It's my scoop that I go in and start working with those kind of features within the system, just to see if I can start bringing that buoyancy out of the hyoid. So in other words, if my tongue goes out, right, you can feel how it tucks and pulls up the hyoid, right? Now nobody thought they'd have so much attention on their hyoid bone, right? So if my tongue goes down, let's say, and pulls, do you see how now my hyoid only knows this movement? It's not learning that push.
I mean, it only known to go down.
Yeah, it's only getting a life experience of going down. Or like with Graham, he stabilized his head with his tongue. Then it's not even, you know. So, and if he's stabilizing his head with his tongue, then that's not happening. Or I talk about too, where they're lifting your head with their eyes. It's just, you can't do a head lift and have hyoid function.
I mean, I had a friend who, when he was writing, he had to, like, it's funny, but he took the tongue out, so probably it's kind of a to stabilize the head or the vision, probably. Yeah.
Not just
But he
kids.
was an adult.
Every class I teach, I've had people try to do headstand in yoga. Any kind of balancing. So they try and stabilize through their tongue.
But the body is that sensitive, but it's not a good thing. You aren't going to get to, I would be hard pressed to see if someone of high, I shouldn't say stature, because that's not what I'm looking at, but that is a multitasker that has a kind of stim like that, or needs to balance in that way. It would get in the way of that finite, like, I couldn't see Bruce Lee doing that kind of thing, you know what I mean? Like, not to pick on athletes, but I mean, or like Elon Musk, you know, it's just, I'm so surprised at what they put. I'm like, the man has autism. Leave him alone. He has autism. He's running 3 companies. It is what it is. So, and yes, Elon Musk has autism, but he functions. But when you have money and you have brains like that, then you're just eccentric.
Yes.
So another thing what'll start to come too for high-end, like skiers, or let's say that countering basketball players, you need to then have a counter within the jaw and the hyoid at that level. Whereas at first you'll get much more of a long countering, and then it will start to. So that's why too, when you see a kiddo that's slosh, what I call a slosh, the hyoid is getting, and again, a positioning that usually only comes later in life that they can handle. And it's very hard to handle the balance when they have that going on. So, how's that for Fred? Any other questions with Fred?
So what is the touch that we're trying to do?
Well, I'm now gonna work on a human.
Yes.
Just volunteers, right?
How it works together, the hyaloid movement and the pubic strike.
Well, first of all, so here, if we can throw him on his belly. Make it a bit more visual. So when you have a pubic bone strike, right? At that point, the weight then can transfer as a seesaw. So sorry, he would be here, we get that. We just, these skeletal systems are. That's okay. So the hands wouldn't be up, they would be down, but you know what I mean. So he's not gonna. So when see, this is what happens. A child never lifts. See the symmetry that goes on, and like a seesaw. So the strike of the pubic bone is the fulcrum. But at that point, because what Dora was saying, the whole spine, the ribs all come into play, and it's that point where the hyoid now can start going away, so they go away from each other. So they'll come out here, and then it even gets accentuated by the tongue coming out. So if I'm here, my pubic bone is going down, my hyoid is going up. All right, and it's extending almost like a Pez dispenser, for those of you that have Pez candy. So it doesn't matter. See how the diaphragm can go nice and long, or the whole abdomen region, right? So when a child then is trying to lift their head,
Nothing's moving.
well, not only that, but then you see again that hyoid is not coming in and out. Just like a pubic bone is not coming in and out.
And because of the hyaloid bone buoyancy, we can swallow in almost any position.
Well, once that happens, so if you follow the whole swallowing course, so first there's the suck that comes up through the tongue. So if I'm just sucking and nursing, right, now it's bilateral, so my eyes are learning this, and they're learning this, I'm learning that counter, right? So look at what my hyoid bone's doing, right? Now if I'm a bottle-fed baby, all of that disappears. Now the food comes to me. I don't reach for my food. I come back. Bottle-fed baby, the suck is more in the back of the mouth, that kind of thing, right? But at some point, which I believe takes a good pubic bone strike, the pubic bone strike happens and the suck can go from the tip to the back. And so you do a palate strike. And so the countering happens in the soft tissue at the top. Right? So when people go, oh, I want my child to suck from a straw, that's a completely different suck, because you are drawing the liquid. If you actually think about sucking a straw, you're not doing a teat strike and you're not doing a bottle strike. It's a draw. So the question was online, but she's not here. She's going to come. But if you have a high palate and now your child's growing and the high palate goes worse, you know what I mean? How do you suck from a straw? You literally would have to bring the straw to the front and try and get it up that way. It's a very difficult thing. So that's why a lot of kids have a suck that are special needs, but then they lose it. They lose it, to me, more of the jaw shape and the palate shape, because they just can't maintain that architecture. Especially too, if they then have had a cold, most likely, and the nasal thing, now I'm going to choose breathing instead of breathing through my nose, it's through my mouth. I can't suck, and so then the skills are lost.
This might be a question for another time, but like Bo sucks through a straw. He started being able to suck through a straw at 1, but it came later. He sticks his tongue out with the straw, so liquid, because of the pressure in
Right.
and out, but it doesn't have, his tongue's not always hanging out.
Right.
But it's like
Well, this was where this will probably help you because of the hyoid bone and all of that, because you don't have the power here.
to bring it back down.
Right, so think of this, take the hyoid bone and sort of scoop it and press it back around that tongue. Right, that's a pretty substantial muscle, and this is where we're going to be covering today too, sort of where I was saying to people, push me away in walking or push me away. Go right here, right above the hyoid bone, and now just think of pushing your fingers away with your tongue. No, don't stick your tongue out.
The opposite way.
Don't stick the tongue out,
Go back.
like a frog almost. No, don't do the jaw, just do the tongue.
Maybe it's easier if you stand against the wall.
It might be easier, but I'm trying to show you, it's not easy.
No.
So for someone like Bo, and that's where chewing has to come in. Guess what? When I chew,
You can chew, but not.
yeah, but
efficiently.
when I
Not-
close your jaw tight, think of the teeth going in and now tongue going down. So if I have stuff in my mouth, what happens? My stuff pushes my tongue down, right? It creates more of that vacuum. But again, if you don't have that action, then how do you chew? The tongue goes up, and now you can't close the jaw because you don't have the counter of the tongue with the teeth.
Michelle, in terms of Bridget and Jane, if that it's like irritating the thyroid, then that's also going to have an impact. It's not obviously not just on the swallowing, but also on our ability to stabilise from the pelvic.
Well, what's also gonna have with something like that, where's my concerns, if you've watched my uvula videos, I swear, they're in Oxford. I'm so sorry I didn't talk to them, but the slow-mo guys, I want them to do a slow-mo of a birth. If anybody knows them, I've tried to bug them. But they do a gargling, the slow-mo guys, and they go, ah.
Yes.
Well, if you've seen it, that uvula is like a little mini monster. I don't know how, you'd think it's this little thing that's dangling, right? But it actually can do, with wet tissue, a full rotation and help clear your bolus. But it's also, to me, a pendulum. So my concern is the NJ tube is because I believe why does scoliosis happen on maxillary kids, especially around puberty? It's because their sexes start to drop, the uvula gets bigger, but they're laying down and it throws off their central nervous system, so they start curving. So you see a lot of scoliosis doesn't happen until, quote, puberty time, around 10 to 12, let's say. So, but when Quinn is laying there, I'm more concerned that her uvula has got something to play with this way, with the NG tube versus her tongue bolus going forward.
Because she does a lot, like I think we said before, she does a lot like throwing her head back, and it's not like an arching from reflux, because she's been.
Oh, well, that, she's just, it's.
She just throws it back.
She like, this is what we've been covering all week, like when I talked about the liver and stuff. That's just too much of a mass on her system. And she's got an inanimate object down her throat, but it's also, it doesn't rotate, it doesn't have buoyancy. It's just laying there in her. So if it lays in a position, I can scratch my ass if I have to, because my underwear, you can't sit there and like, I mean, what do you know, so I'm not trying to say that to make you feel bad. I'm giving you a level of awareness, but my goal would be to get rid of it as soon as possible, as soon as we can. But yes, and once it is out, we've got to do not only a lot of this, what we covered, but what we're covering today is this buoyancy. So now just think of rotating back here to here. And again, you'll start to see the pubic bone come way more into play. So yes, it's having a big impact in her ability to sit up, and it's having, especially too, the way they placed it. If they placed it, let's say when she's here, and she's suddenly doing this, and it stretches on that, which it's just like her rolling around. It's gonna tether her to this position versus to this position. But they may not have her at this because she's more like this, and that's a good, what, when I do that, what, an inch and a half? So that alone, and then it's taped here, and then it's in, because she has a J, not an NG.
Yeah.
So that alone is going to change range of motion if that's the language you want to use. Right? So if you're doing the life, even of my pair of shoes, if I suddenly have 5-inch stilettos plus that, it will alter my walking. Yes, it's a bit drastic, and you wouldn't want to know me by the 5 o'clock because I'd be biatch. But you know, I don't do a girl very well as far as the dress up goes. But, you know, so if we changed everybody's clothes right now, if I just had you wearing T's outfit versus, you know what I mean, it'll adjust you. So I think just professionally to say, I don't know, or it shouldn't, you know, when it's going down your throat, oh, hello, you know.
It's amazing the amount of kids that have that and they don't know.
Well, not only that, but pegs are really not pushed in other countries other than the U.S. In the U.S., you'll see a much more higher amount of G-tubes. And people think, like my husband did, it's my biggest regret that I didn't tube Graham, because I could have gotten spinach in him. You know what I mean? But I don't have that ability. So, but they really don't push it. In India, for the most part, if you can't eat on your own, or at least whatever, then you pass. You know, they're not looking to put a peg. Or the countries don't have the facilities, like in Mexico, or so they don't have the supplies like here.
But isn't there also a higher chance of infection or the other way around?
Oh, actually, no. It goes right into stomach acid. Really, it's very, very, very rare of all the surgeries you're going to do to put in the G-tube. You'll have like irritation granule, or if a child picks at it, maybe, but really it is not. And for the most part, you know, like these seizure meds, they taste god-awful. Put the junk in there and save the mouth for the good stuff, you know, until you work on the skills enough to switch over. It doesn't mean your mouth's never going to work again, but that's the biggest fear.
So the G-tube is less invasive on the
Oh, then an NG tube, yeah, or aspiration. If you're constantly aspirating, going into pneumonia, I see these kids just choke to death and they can't go past like a liquid, like, child at, one of the practitioners I have in Vietnam, you know. So she's 7 now, and 2, those kind of kids can't get the volume that they need. It's one thing to bottle feed a kid. You want to bottle feed a 15-year-old, you're gonna have to, you just be there all day. So, I mean, continuous, again, reflux, a continuous low dose drip feed in the middle of the night is a nice setup. You know, it takes a load off, lets the parents sleep, God forbid. So, but nobody thinks about all those things. So also too, just to cover one last thing with the hyoid, and again, this buoyancy thing, guess what? When I lay down, what happens? Right? So if my head is here and I'm adjusting, where am I adjusting through? The hyoid makes a lot of adjustments through all of that. Where the way that my tongue lives on my mouth. So let's say I have an abnormal palate or mouth structure, I've had dental work. Maybe now I'm only lying on my one side because of the way my tongue hangs when I'm sleeping. I just don't realize how sensitive, in a sense, my system is. But when a baby is learning to move around, right, where's that hyoid going? So that's why the hyoid is so critical, that it gets good function within the absolute horizon that way before it goes to a vertical function and it can start doing that. Because it's really one of the first bones that can protrude and separate from the spinal column. So with that, is that enough for the skeletal? We're good?